Educate you about CoolSculpting. I'm going to treat Sarah here, my patient. We're going to do her lower abs today, and I just wanted to show you how CoolSculpting works, answer any questions that you have, educate you, show you that there's not really any pain or downtime, and what an amazing procedure it is. So we're going to kind of go through a consultation right now, and so here we are. So what brings you in?
Well, I like to work out. I'm generally pretty fit, but I have a couple stubborn areas, particularly my lower stomach. My weight fluctuates, but no matter what I do, I always have a lower pooch that hangs on if I'm bulking or cutting. No matter how much weight I gain or lose, this stays with me.
Perfect.
I'm at a lower weight right now for myself, and I can't lose this last part of me. Particularly this last little part, I always have this shadow and I can't get rid of it.
The little pooch. Okay, so you actually are a perfect candidate for CoolSculpting. So if you come over here, I can show everybody, if you can pinch an inch, you can freeze the fat. So everybody can see right here, she doesn't have a lot of fat, and she does, she's very into health and fitness. But what CoolSculpting does, it spot treats those areas that diet and exercise don't take away. So it's an amazing procedure. There's no pain, no downtime. And I'm gonna go ahead and educate you on it and tell you how it works. So what CoolSculpting is, it's a 5-step process of a volume reducing procedure. Step 1, I'm gonna put an applicator onto your body. It's gonna sit on your body for 45 minutes. And what it's gonna do is freeze and kill your subcutaneous fat cells. The subcutaneous fat is the squishy fat that's more superficial on top. That's what CoolSculpting helps reduce. Step 2, my goal is to kill as many fat cells as possible, and we do that through massage at the end of the procedure. I here at Cosmeticare use a massaging gun because the vibration actually is going to be deeper and more continuous than any human hand is going to be, and kill more cells. And that's our ultimate goal, is cell death. Step 3, once the cells die in our body, they're naturally eliminated from our body through our waste, sweat, and urine. So you're literally just going to pee them out. It's a super natural process, but it also, because we're getting rid of the fat cells, it makes CoolSculpting results permanent, which is awesome. Step 4, the cells that are left there condense together, and step 5, your body shrinks. So CoolSculpting, it's not an overnight process. It's something that you have to be patient with. It takes a little time to start seeing your results. You start seeing them between 3 to 5 weeks, and then it's a gradual reduction over a 3-month period of time. There is a 20% reduction each time you treat a specific area. With that being said, it's very rare that I only treat somebody one time. I generally do 2 to 3 sessions on each patient in each area, and I generally do them about 4 to 6 weeks apart. That's about it. We're gonna go ahead and treat her. Let me go ahead and draw on you. Yay! Okay, so one other thing that I want to share with you guys, because I know this is a misconception in the CoolSculpting world. A lot of people ask what a cycle is. So this is considered a cycle. This covers a certain area, say like a love handle area or a small area on your stomach. This is considered one cycle. This is 35 minutes long. This is also considered one cycle. This is for smaller people, different areas. This right here is considered 2 cycles. It's 45 minutes long, and it covers a greater area. It's actually my favorite one because we get to kill more fat cells with this. So, gonna go ahead and circle her here.
So how many cycles do you think I will need?
Well, this is 2 cycles. Mm-hmm. You're gonna need 2 sessions.
Okay. To get rid of this.
Yeah. And then I'll assess you a couple months after the 2nd session and see if you need a 3rd.
Okay.
Yeah. Okay, you can have a seat, my dear.
Now you can see it sitting down.
There's the little pooch.
There she is.
There's the little pooch.
Hanging over.
All right. Okay, so you can go ahead and lean back.
Very comfortable.
Yep.
And a beautiful view.
Beautiful view. No pain, no downtime.
A view.
Did you see the view?
I did.
Nice. All right, so what we're gonna do, we're gonna first clean her skin.
We have someone on here asking how much is a session.
So it depends on how many cycles we're doing. It depends on what area we're doing. It depends on how much fat the person has, and it depends on how many cycles we're doing. So the cost with CoolSculpting goes, it's a certain amount per session. Today we're having a big special, so the costs are a lot lower per cycle, and you can call and come in for a consultation, and I can assess you since everybody's body shape and size is different. The treatment cost is different, if that makes sense for people. Okay.
Consults are free.
Consults are free.
Love it.
And we get to have fun.
They said, how do I schedule a consult with you?
Oh, you can call our phone number at 949-718-6900.
Or even DM us.
Yeah, DM us.
Oh, DM us.
DM, message us.
And we can book that consult for you. All right, here we go.
Okay, so this is the gel pad. This is pretty much her skin protector, so the applicator never actually touches her.
I want to know who doesn't have this pooch. The people who get CoolSculpted.
You won't in a few months.
Yeah.
Yeah, exactly.
They got
You're welcome.
CoolSculpt or Lipo. And you know what hurts?
The lipo.
I'm just going to ask these questions as they come in. I have a little under my chin. Can that be CoolSculpted?
Yes. So we have what's called the Cool Mini, which is this applicator right here. And I love doing chins. I've done thousands of chins and they actually come out amazing. It's the one area on our body that we cannot hide. And so, CoolSculpting, it's also FDA cleared to tighten the skin under the chin as well, which is awesome. Okay, so this is gonna kind of feel like a vacuum suction in your body. Yeah, it's not gonna hurt, but it kind of feels odd.
Let's see. Someone said, how do you get the deal today? You call.
You call.
You
Come in and see us. Yeah.
You can always DM us too, and we can book you an appointment.
And I can also do a virtual Zoom consultation if you prefer that. And we can do it on the phone, and I can look at your body that way. This is just gonna suction her in. It's kind of like a vacuum suction in your body. Again, there's no pain with CoolSculpting, but it's very odd because it's not often we put vacuums onto our body. Okay, and if you could hold on for just a second, please.
No pain. She didn't lie.
No pain. All right.
Someone said, how much is a consultation? It's free.
The consultation is free.
You get to hang out with Jill.
Yes.
Pay to hang out with Jill.
Okay, you could. You can let go.
Corey says, hi, Jill.
Hi. Okay, perfect. So I'm going to go ahead and start this. So there's a couple things to go over. This particular cycle is 45 minutes long. So this is what she's going to feel right now. It's going to get cold, and then it's going to get real cold for about 5 to 7 minutes, and then it's about minute 37. It's going to go numb for the rest of the time. There's no pain with it. It feels like the process of an ice pack. So it gets cold, it might get prickly cold for about 5 minutes, and then it's gonna go numb for 37 minutes. My patients are generally in here watching Netflix, ordering DoorDash, taking naps, doing emails, like it's virtually a painless procedure. So you're gonna sit here with this for 45 minutes. This is your just in case button. So if you need me for anything, it'll page me, okay? If I don't hear from you, it's gonna automatically page me when there's a couple minutes left of the procedure. So I know to come to prepare to take it off your body. When I remove it from you, the area that's been treated is gonna be bright pink. That's gonna last for about half hour to 45 minutes. It's just from the suction and the cold, no big deal. It's also gonna feel frozen and numb. in that area. They're kind of, it doesn't hurt, but they're odd sensations to feel together at the same time. So, and then I'm going to massage you.
Okay.
The massaging part is probably the most uncomfortable part. But since I use a vibrating massaging gun, it's actually not uncomfortable, but it is a little bit ticklish, to be honest. So
I'm ticklish, so I'll probably laugh.
you're gonna laugh. So that's okay. And it's only 2 minutes of your life. So I'm gonna massage you for a couple minutes, and that's about it.
All smiles under here.
Yay!
I have some.
Yeah, you have questions?
I have some questions coming
Okay,
in.
then.
What is the difference between CoolSculpting and lipo?
Okay, so CoolSculpting is 100% non-invasive. You're not and the results are different. So there's no downtime with CoolSculpting like there is with lipo. It's obviously not an aggressive procedure because she's just kicking back here and doesn't have to do anesthesia. There's no recovery time or anything like that.
No incision sites.
There's no incision sites. It's literally not surgery. So, also, the results are different. So because this is a non-invasive procedure, there's about a 20 to 25% reduction each time you treat a specific area. With liposuction, they remove a much greater amount of fat cells, so you do get better results. But it just depends on the person, the preference, if you'd like to go through the downtime, through surgery, or a non-invasive procedure, because we have busy lives today.
Okay. And then what is the pricing for today? What's the special?
Okay, so
Let us know.
it's pretty much our lowest pricing. We are doing discounted pricing down to $500 a cycle, which is an amazing price for CoolSculpting. As I said before, it's kind of hard to say what cost would be because everybody's body shape and size is a little different, but it is down to $500 a cycle today.
All right. Is there any aftercare?
Good question. So this is what I was just going to talk about. This is Elastin Transform. This is a lotion that I use for all my patients. I have them use it twice a day. What this does is help with crepey skin, helps to tighten the skin a little bit, and it also has an ingredient in it that helps to make your CoolSculpting results better. So the only aftercare that I have you do is to put this on twice a day and drink extra water to help flush the cells out of your system. Other than that, there's zero restrictions with CoolSculpting. I do encourage my patients to work out regularly because another way that you're going to get rid of the cells is to help sweat them out. And then again, like I said, drink more water to help pee.
Someone wants to know what the cost for the applicator is that's on Sarah right now.
So this one is considered 2 cycles, and we're going to do it again in a month. So it would be 4 cycles total. It is normally $2,700 for 2 sessions. With that, today it's $2,000.
All right. Awesome. Cool.
Yay! How's it feeling right now?
Great, no pain.
Is
Let's
it kind
see.
of cold?
A little bit.
Not too bad? Okay.
Can you have it? Oh, sorry. Can you have any sort of allergic reactions?
There are a couple very rare side effects. Allergic reaction, no. It's literally not touching your body. It is nothing going inside. If somebody is very sensitive to the cold, they may have high sensitivity levels towards it, but there's no allergic reactions.
Okay.
And it's a very, very safe procedure because it's literally just the cold. It's not like a laser, it's not invasive, it's not surgery or anything like that.
Someone said difference between CoolSculpting and the other procedure where they heat up the skin to remove fat.
Okay, so
Do we know
they
what
might
that-
be talking about True Sculpt. There's a couple different heated procedures. The doctors that invented CoolSculpting, it was these 2 Harvard doctors, and they found this amazing correlation between how our fat cells react with the cold. And CoolSculpting has actually been the first non-invasive body contouring procedure to come out, and it's still worldwide #1. Reason being because that correlation. So I do highly suggest, if you're going to go a non-invasive body contouring route, do CoolSculpting and do the cold. The other procedures that I've actually used on patients, you don't get the same results. There's just not the same reaction.
Okay. Someone's asking a medical question.
Whoa!
Paradoxal adipose hyperplasia. If you fall into that category, how do you treat them?
Okay, good question. So CoolSculpting was revamped about 6 years ago, and with that revamping, the amount of people that actually get that hyperplasia are about 1 in every 450,000 people. So I've personally never seen it besides on video. What it is an adverse reaction, and your body doesn't react to CoolSculpting the way it generally does for 99.99% of the people. Your body kind of swells up and grows. If that does happen, CoolSculpting, obviously we monitor you. I have you come back for follow-ups, and if that happens to happen, CoolSculpting does pay for liposuction to fix that. But it is extremely rare.
Perfect. Someone wants to know, how much is the after treatment cream, Elastin?
It's $195. A little bit does go a long way, so it will last you quite some time. Today it's on special for $125.
Woo-hoo!
Yeah.
Okay, awesome. Let's see, what else? Oh, tell us a bit about yourself, Jill.
Whoa.
Yeah.
Tell us a little bit about you.
Awkward. What do you want to know? So I've been doing CoolSculpting for over 7 years. It's a huge passion of mine. As outside of here, my life pretty much revolves around health and fitness. So I get up, I work out at 5 o'clock every day, I lift weights, I meal prep, I do all that stuff. I also CoolSculpt myself because, like I said before, the gym doesn't spot treat. So this is an amazing procedure that helps with that little frustration that we have, because we all have little pockets of fat somewhere. That's about it. Like, my life revolves around health and fitness. I love what I do for a living because it all kind of goes together. And I love helping patients. I love helping people fit better in their clothes, feel better about themselves. It's great for summertime coming up, for the bathing suits.
Amazing. How long do the results last?
So the results are permanent. Yay! Like I said before, you start getting results somewhere between 3 to 5 weeks, and then it's going to be a gradual reduction over a 3-month period of time. How our bodies work. Okay, so since puberty, we do not regenerate new fat cells. And what happens over the years as we gain and lose weight a bunch of times, our fat cells expand and shrink. And CoolSculpting is actually removing the fat cells from your body, so you will forever have less fat cells in the area treated.
Cool. Let's see. How many years have you been doing CoolSculpting?
7.
7 years? All right.
Professional.
How's it going?
It's been out for about 10. I've been doing it for quite some time.
It's going great. I'm numb now.
It's numb.
It's numb
yeah.
now.
You're at minute 35, so you're 10 minutes in, and it feels like just something's on your body, right?
Yeah.
Yeah.
Feels numb, no pain, just numb.
And then what she's going to experience afterwards, so the recovery part of it, like I said before, there is no downtime with this, but the area that's been treated, she will feel tender to the touch for about 3 days. She will feel numb to the touch for up to 2 weeks, especially with this bigger applicator right here. There's no pain associated with it, but it's an odd feeling. Like when she pulls up her pants, she'll be able to feel, something like that. But if she's not touching it, you kind of just forget you had it done.
Are you an RN?
I am not. You do not actually need to be an RN to do CoolSculpting.
Okay.
She's a master.
Yeah.
But I am master certified in CoolSculpting.
So what does that mean if you're master certified?
So it's extensive training. It's more extensive training, learning more about it. And I was actually the first CoolSculpting specialist in Orange County to get master certified.
Okay.
Yeah.
How many treatments does a chin normally take?
Generally 2, depending on the person. There has been a few, very small number of people that I've only done 1 chin treatment and they've been really happy with it, but it's generally 2 to 3, and that's pretty much with every area. And the chin comes out amazing.
Awesome. Are you able to be in the sun after treatments?
You can.
All right.
You can be in the sun, you could take an ice bath, you could do hot yoga, you can go to the beach, you can do anything you want. There's really no restrictions. Yeah, please work out. Yes. We want you to work out, sweat those cells out.
Is CoolSculpting Mini cheaper than regular?
It's not. The cycles are the same price.
The cycles are the same.
Correct.
Okay. Cool. Any other questions? Anybody's on the live. Shoot.
Anybody there?
Anybody there?
Hopefully today we were able to educate you a little bit on CoolSculpting, talk about pros and cons of it, kind of what to expect, see somebody being treated, to see that it really is pretty much a painless procedure. Yeah.
Someone wants to know, how do you get the deal on the Elastin body cream?
Call
on
us.
in.
949-718-6900.
Come on down, folks.
Come on down. So next week, I'll also be doing, for people that have watched this today and are interested in coming in for a consultation, I would love to assess you and make sure that you're a good candidate for the procedure. I will be doing this special all next week as well. So you can get the Elastin, you can get the cycles at a discounted price, and we can meet.
You got any before and afters you can show the camera? She's on the spot. She's on the spot.
The only one that I have at the moment right now printed out is this one.
Let's see.
How do I do that? Okay, so you can see this is after 2 treatments on the abdomen area.
Woo.
So you can see the reduction in her stomach and how great it is. CoolSculpting does not take all the fat away like Liposuction would, but for no downtime, no pain, and just kicking back watching Netflix, this is a really great reduction.
Awesome.
Yeah.
Let's see. How many days a week are you in? And do you work weekends?
I am here Tuesday through Friday, and we are open 2 Saturdays a month. So we're open the 2nd and 3rd Saturday of every month from 10 to 2, and I'm here 9 to 5 Tuesday through Friday.
Okay. Does a chin take 30 minutes or 45 minutes?
The chin is actually a 45-minute cycle, and I generally do 1 cycle on this side and 1 cycle on this side, which is going to define your jawline as well as take away that little pooch there. So with the chin, doing both sides, you're here for about 2 hours.
Okay. Do we have to pay for the special today or at the date of the procedure?
So we could actually do a deposit today, and then you pay the balance when you come in to get treated.
Okay. Are there some areas of the body that maybe we wouldn't know that could be CoolSculpted?
Okay, so CoolSculpting is FDA cleared for 9 areas of your body. So we have our chin, we have our arms, we have what's called the axillary puff for that area that sticks out of our sports bra. We have the upper abdomen, lower abdomen. We have outer thighs, inner thighs, and we have back fat. So we have our flanks, we have our lower bra bulge, we have our upper bra bulge, and I can do the inner knees and the top of the knees as well.
Oh, that's cool. I didn't know
Yeah,
that.
it's awesome.
All right. When does the deal end?
So we're going to continue the deal through next Friday. So we have all next week with these special prices.
Woo woo!
Yay!
Will you lose weight?
Good question. Our fat cells are actually pretty small. Generally, I do weigh all my patients prior to the procedure. Generally, people might lose like a pound or 2. It's more of a volume reducing procedure. I have had people that have lost quite a bit of weight, and I had one lady, I treated her stomach 3 times. She lost 9 pounds, which was awesome. But that is not the norm. It's generally a 2 to 3 pound difference. It's more of a volume reducing procedure where you're going to see that your clothes fit differently, you look a little better, the pooches are smaller, that kind of thing, more so than a number on a scale.
All right. Let's see. Anybody else have any